Welcome and thank you for attending today's training on surveying CFCHS funded clients electronically via SurveyMonkey. Implementation of this new method of collection is set to begin in January 2020 during the third quarter of the current fiscal year. Survey coordinators will be sent an email with special instructions and the hyperlink to the survey in the coming weeks to begin surveying clients electronically. Paper surveys can still continue to be administered and collected for those clients wanting to complete the survey manually or electronically. Please note, the collection of completed paper surveys will continue through June 30th, 2020. Why CFCHS, the ME, requires the collection of surveys, whether it's in paper format or electronically for funded clients served. Why does CFCHS, the ME, require the collection of surveys, whether it's in the paper format or electronically, for funded clients served? The managing entities which subcontract with individual service providers are responsible for the collection and submission of survey data from each subcontractor. The ME is responsible for reporting results quarterly to SAMH. The ME has the responsibility of collecting surveys and ensures subcontracted service providers collect the required sampling and data collection on clients' rating of services received. The annual total of required sampling is determined during the initial contract negotiation and data submitted into the DCF data management systems, informing of the number of clients served by the subcontractor during the previous fiscal year. Each subcontractor is required to offer and collect survey data from consumers in the following 4 program areas with lengths of stay of over 30 days: adult mental health, adult substance abuse, children's mental health, children's substance abuse. Exempt from collection of survey data are short-term programs, an example, are crisis units, detox-only services, and prevention services which are non-client specific. The electronic form of the survey will continue to capture the same information as that of the paper survey. The survey questions are designed to assess the consumer's perception of care in 7 domains. Each domain has a number of questions related to specific areas. For general satisfaction, access to care, appropriateness and quality of care, outcomes of care, involvement in treatment, social connectedness, functional satisfaction, as well as some demographic information. In the Appendix A of the DCF PAM 155-2, Chapter 13, it denotes the survey questions to the corresponding domain. Please refer to it if you want to know which questions apply to which domain. In total, the survey is composed of 47 questions. 11 questions are shared in the adult and child survey. 20 are related to adult services, and 16 of the questions are related for children's services. Why did we choose to go from paper version to electronic? One of the reasons is to assist with minimizing human error, which leads to survey invalidation, such as surveys are invalidated when any of the demographic fields are left blank. The wrong survey is administered. For example, adult surveys are to be completed by individuals ages 18 plus and refer to the person who is receiving the service, not the person assisting the client. Child surveys are to be given to clients through age 17 or a parent representative to complete on behalf of the child. Multiple responses are selected in a row, which will invalidate the survey. Sometimes fields are left blank. Markings are too light for the scanner to pick up a response. Pages are missing, or entire sections of the survey are left unanswered. In fiscal year 18-19, CFCHS received a total number of CSS surveys. In fiscal year 18-19, CFCHS received and processed 4,257 surveys. Of those, 3,695 were valid. 562 were invalid due to the reasons I previously explained, as well as DCF considers a survey invalid if 2/3 of a question in a domain is left unanswered, or if the client does not complete any of the required fields in the demographic section. In the electronic survey, all questions require a response. The only exception will be open-ended comments. The electronic survey will go live for all users and will be sent to the survey coordinators via email in the coming weeks. Survey coordinators will be responsible for sharing the survey link with its team members to initiate survey collection. Each survey coordinator is responsible for determining the method for the client to use, whether it's the electronic one or the paper version. For example, if you're a case manager at the time of visit, you can either share the link via email for the client to complete on own accord or have the client take the survey in person with you using either your personal device or their personal device. They can do it via their mobile phone or a laptop or a tablet. The electronic survey will go live for all users and sent to the survey coordinators via email in the coming week. The electronic survey link will go live for all users and will be sent to survey coordinators via email in the coming weeks. Survey coordinators will then be responsible for sharing the actual survey link with its team members to initiate survey collection. Each survey coordinator is going to be responsible for determining the method for the client to use, whether it's an electronic or paper version, depending on the client's ability to use computers or their understanding. We still want them to complete the survey, whether it's done electronically, which is the preferred method, or if they struggle with electronics, then the paper method is the best mode to go with. If you're a case manager at the time of visit, you can either share the link with the client at that time for them to complete on their own accord, or you can have them complete it using your device, whether it's your laptop, your tablet, or your mobile device to complete the survey. Please keep in mind a client does not have to complete a survey at each visit. It's usually at the beginning, then again at the end of services to provide feedback on services received. I wanted to show you a quick demo of some features that I want all survey coordinators to keep in mind when teaching their staff. Two things I want you to keep in mind. If you have a client who is Spanish speaking and can only read and write Spanish, they select on the right-hand corner drop down, you will see for Español, which will then change the questions to Spanish. Another feature is, depending on the method of the survey that is being used for them to complete it on, whether it's a desktop, laptop, the screen will conform to view depending on what is being utilized, whether it's a desktop, a tablet, or a mobile phone. You see that the screen changes to fit that mode. You see that the screen changes to fit that mode. So now that you've seen those views, keep in mind again the English and Spanish drop down to convert the survey, and also the mode to be utilized, whether it's the laptop, the tablet, or the mobile phone. The survey itself will take about 10 to 15 minutes for a client to complete in total. One of the next questions that many of you might have is, how are we going to determine or track the number of surveys that have been collected? To determine compliance with how many submissions to meet contract compliance with fiscal year totals, each provider has been listed, as you see on the screen, as one time. Only one response can be selected at any time within this frame here. To determine compliance with how many submissions to meet contract compliance with fiscal year totals, each provider has been listed as you see on screen. Only one can be selected at any time. Once an agency has been selected, the completion of the survey will count as a submission. On question 2, even if the participant selects no, I refuse, the survey will still count toward compliance counts because it will capture in question 1 who the provider of the services for the client is, as well as the number of refusals that are being generated. That's all. On behalf of the compliance department at CFCHS, we thank you for your time. And please, if you have any questions, please contact me via email or phone call if you need further assistance. You can reach out to myself, Miralis Martinez, the quality specialist, Giovanna Gonzalez, the risk manager, or Benjamin Ho, quality improvement specialist. Any of us will be happy to answer your questions and better assist you. Thank you for your time, and we hope you have a wonderful day.